Yes, sure.
One is pneumococcal polysaccharide vaccine. This is a short-acting and T-cell independent vaccines. And second is pneumococcal conjugate vaccine or PCV. This is a long-acting vaccine and gives mucosal immunity. There are 4 different types of vaccines: PCV 10, 13, 15, and 20. PCV 13 has been the commonest available in India, and only one dose is given in life for adults. However, whenever the Prevnar 20 becomes available, this can be given. In normal persons above the age of 50 years, for we ophthalmologists, our families, everyone should get a single dose of these vaccines. And persons below the age of 50 years with immune suppression, PCV 13 is given one dose, and this is followed by a dose of PPSV 23 after 8 weeks and 5 years. PCV 10 is used in children. PCV 15 is being developed in India by Serum Institute of India. PPSV 23, this has 23 different strains of pneumococci. Immunity lasts 5 to 10 years. 19 to 50 years with comorbidities, single dose is given. 19 to 50 years with immune suppression, 2 doses after a dose of PCV 13. And after 65, 1 dose is reserved for person above 65. Only 3 doses can be given in life. Flu and typhoid vaccines. Flu, this is an inactivated tetravalent vaccine, 0.5 ml given intramuscularly. For all, dose is same for children, small children, 6 months, and for all others, healthcare workers, pregnant women, and those with comorbidities. Typhoid conjugate vaccine, most cost-effective vaccine, only single dose is given throughout life. Same dose, 0.5 ml for adults as well as for child of 6 months of age. Measles, mumps, and rubella. This concerns of ophthalmologists also. This is a live attenuated vaccine. This should be given in preconception period or to adolescent girls to prevent congenital rubella syndrome. At least one dose should be given, and pregnancy should be avoided for 1 month after that. All healthcare workers, including we should get 2 doses, 1 month apart. MMR can be replaced by MR or RVEC. Coming to hepatitis A vaccine, there are 2 different types of vaccines. Killed vaccine, 2 doses are given. In children, half ml, and adults, 1 ml. And second is a live attenuated vaccine. Single dose is given 0.5 ml. Same dose for children, small children, as well as for adults. All adults, all healthcare workers, all doctors, they should get it if not given in childhood. So if a person is immune compromised, only killed vaccine should be used. Hepatitis B, 3 doses are given at 0, 1 and 6 months if you did not get it in childhood. Boosters, they are not recommended routinely. However, post 50 years of age, one can get a booster, or one can get IgG level checked. If they are below 10, then one can go for booster. Chickenpox or varicella vaccine. Dr. Jyoti Biswas showed slides of this choroiditis or retinitis caused by this zoster virus. This is live attenuated vaccine. 2 doses are given in adults, 4 to 8 weeks apart. All adults, all doctors, all healthcare workers, they should get it. If they did not get it in childhood or did not have chickenpox, then all the contacts of the herpes zoster ophthalmicus patients, they should also be advised this vaccine. Then coming to shingles or the zoster vaccine. This is a different vaccine from this varicella vaccine. This is a high potency vaccine. 2 doses are given in persons above the age of 50 years to prevent herpes zoster. Tdap. Many of us may not have heard this name, Tdap. This contains reduced dosage of diphtheria and acellular type of pertussis component and full dose of the tetanus vaccine. This can be used above the age of 7 years. Tdap is used every 10 years till the age of 65 years, after the age of 10 years. In pregnancy, this vaccine, one dose is must in pregnancy, and all healthcare workers, they should get this vaccine. Then coming to rabies killed vaccine, all of us should get the vaccine pre-exposures, because once we are going outside, the dogs are everywhere and we may be bitten by a dog at any place, and vaccines and the antibodies, they are not available everywhere. So 3 doses are given pre-exposures, And if a dog bites, then after that only 2 doses are required and no antibodies are needed. All doctors, they should get it. Post-exposure 5 doses are given plus antibodies if it is a class 3 bite. Human papilloma virus vaccine. There are 2 different types of vaccine, 4-valent and 9-valent. This prevents cervical, genital, oral, anal, head and neck cancers and genital warts. Recently, Cervavac vaccine has been developed by Serum Institute of India, and this will be available in National Immunization Schedule this year. The Government of India is buying 16 crore vaccines. At present, Gardasil 4 costs 3,000 rupees, while Gardasil 9 costs 8,500. This is after reduced price after the introduction of Cervavac. 9 to 14 year 2 doses, and above that 15 to 26 year 3 doses. 2-valent vaccine which was being used has become obsolete now. In pregnancy, at least 1 dose of Tdap and second dose can be of Td 1 month before or after Tdap, and plus flu vaccine. Coming to vaccinations for adolescents or young adults or preconception period.
Professor Taneja, please try to sum up.
Yes, sir. The last 2 slides, sir.
Sure.
Preconception period, MMR, flu, typhoid, hepatitis A and B, varicella, human papillomavirus, and Tdap. In adults, TCV, flu, PCV, PPSV23, varicella, hepatitis A and B, MMR, Tdap, zoster, rabies, human papillomavirus, and Japanese encephalitis in endemic areas. Special situation, cholera, yellow fever, MCV, Japanese encephalitis. Thank you, sir.
Thank you, Dr. Taneja.